it smells at least a bit fresher. But others will develop the bad breath to the point that sometimes the interventions are not enough.
Exactly. So when it comes to bad breath, mouth odor, we have different types. Just as you said, we have the physiologic. It happens to everyone in the morning after waking up. Then we have the true halitosis, those with the condition. Okay, and when researchers did their research, they came up with the major cause of halitosis being related to dentistry, okay, the mouth. But there are other causes, okay. The source of the bad breath could be from other parts of the body, but majority comes from the mouth. And even in investigating which parts of the mouth the bad breath could come from, they realize that it's mostly the tongue. Okay, people brush their teeth and forget to brush their tongue.
Okay.
So the posterior part of the tongue is where majority of the bacteria resides, and they feed in there and produce sulfur, what we call sulfur compounds. So those sulfur compounds, the smell is so offensive. So that's what comes out as bad breath.
Okay.
So failure to keep our oral hygiene in check could lead to bad breath. So when we report to the clinic, we first do our investigations. It could actually even be due to a cavity.
So cavities can cause halitosis.
Yes.
Okay.
Because once there's a hole, food accumulates. You don't swallow everything. As you chew, the food lodges in within those cavities, and with time they decay and cause that smell too. So it could be cavities. It could be even not flossing, because the brush does not go in between the gums.
That's right.
That's what the floss does. So it could come from that. And certain people with certain gum diseases too, the food debris is able to accumulate in what we call the sockets, the gingival sockets.
Okay.
And with time, it produces that smell. So halitosis is actually not so difficult to treat, but if you pay attention to your oral hygiene, you can put it in check.
Lovely. So once you've